Folks, welcome back to another episode of the NYU GPH podcast. Today we have Dr. Yesim Tozan, an assistant professor of global and environmental health here at NYU GPH. Dr. Tozan is a distinguished expert in health decision science whose research focuses on the economics of infectious disease prevention and control. She leads groundbreaking projects in dengue surveillance, malaria treatment, and the impact of climate change on vector-borne diseases, working across diverse groups of regions from Sri Lanka, Thailand to Europe, and even Africa. I can keep going in the intro, but let's just hear from Dr. Tozan. Dr. Tozan, welcome to the NYU GPH podcast.
Thank you so much for having me. I'm very happy to be here.
We're so excited to have you. Before the camera started rolling, I was asking you about what brought you to public health? When did you start your public health? It's been a long journey. So when people ask you that question, what brought you to public health? How do you usually answer it?
I didn't start with public health. So that's the first thing that I say, because I'm trained as an engineer, environmental engineering. So it wasn't necessarily a very conscious decision to go into public health sciences. But as you can imagine, environment has a close relationship to public health. But as a young engineering student at the time, I started getting quite curious about environmental policy. So when I finished the engineering school, I started asking questions about, how to get people comply with the environmental policies, like the private sector, what are the incentives? And then they told me that I'm kind of asking questions related to public policy. So that intrigued my interest, and the transition was a little slow because I was back in Turkey. That's where I am from. And I needed to continue with a little bit along the lines of engineering and environment, and did my master's in environmental technology. That kind of opened up a little bit more into engineering and health connections, and then after that, I realized that there are schools that are looking into policy and larger field of public affairs, and I found myself at a school of public policy in the United States for a PhD program in science, technology, and environmental policy. So exactly. It's a program that was suited for engineers who would like to get into the world of policy and public affairs. So that's kind of like the wandering way. But then when I was at Princeton doing my studies, that was out of the again my interactions with my supervisor over there, who wanted kind of look into this malaria problem in Africa through environmental management, the historical context of successful malaria control programs. And as part of my thesis, I started looking at that, and by first spelling out malaria, and that was my introduction to public health and vector-borne diseases, and specifically malaria.
We're gonna get deep into the whole vector-borne diseases, malaria, the mosquito-oriented stuff that you're working on. I'm curious to know about before a lot of students, when they just heard your intro, or people watching this, have started from different places. We have had people on the podcast in nutrition, we have had chefs, we have had people that have come from completely different areas, but it all comes back to public health. What do you think are the commonalities with these people? You came from an engineering background and you kept asking questions that, I want this, and it guided you into this direction. What's that thing in people that you notice in public health that brings them into this area?
Everybody has a journey, I think, but the complexity of the problems and, how people kind of seek solutions to those problems. And I was very much intrigued with the interactions, of humans and the environment, and then some of the problems, that we encounter because of those interactions. So that was, and how to kind of remedy or find solutions to those problems. So my world was limited to environment and health and development at the very beginning. But then when I was introduced to a public health problem that is embedded in the environment. And on top of that, resource-constrained settings, I was quite intrigued. So in a way, it was the complexity of the problem for me, and the the historical efforts when I started looking into the published works. And some of them are not necessarily scientific works. I read books about, just written by people who have, experienced, these health problems, and in the course of their experiences, for instance, when it comes to malaria on the African continent, and it was quite intriguing to me, and the complexity of the problem. But I think I have also seen in public health field where people were in the past, professionals were a little bit of everything to be able to address these public health problems. And, they were epidemiologists, but they also, used the data like a biostatistician, and they were interventionists. And they were at the same time working with the people to be able to get their buy-in into whatever, measures that they were trying to put in. So they had this holistic view around the problem and what kind of gets involved with the solution of the problem. So before, it was more like public works people kind of working with the people towards a goal, and that can be malaria control. And I think we have gone through some period where professions became much more well-defined. And, medicine kicked in for certain health problems. And of course, it comes with its own advantages, treatments and to some extent prevention. But I think there was some sort of a divergence. And I think people are again going back to understanding, how are we going to solve this problem, which is very much embedded in a much more complex system, from people to economies to environments, and that has been, to me, the most interesting part of all of this. How do we bring all these pieces together?
I love hearing about this, how everyone, it comes to the same thing. Roles are getting defined now, but everyone has to start with a unique, multifaceted path to get over there. I want to talk about infectious diseases. You mentioned malaria a lot. When infectious disease comes up in most people's minds in the world, it might be COVID as the most recent example.
Right.
What is malaria? What is dengue? What are these mosquito-borne diseases that you talk about, since your time goes deep into it?
Those are vector-borne diseases, meaning that they are transmitted by a vector. In this case, for malaria and dengue, they're specific species of mosquitoes. And mosquitoes are as old as, humanity, and they've been around, and they persist and they survive, and they're the vectors for these diseases. And these diseases are quite prevalent in lower and middle income countries that are mainly in the tropical and subtropical parts of the world. And they were, at some point, malaria was also affecting more temperate regions, but it was possible to break the transmission in these regions through certain, vector control methods. And because of the, patterns, weather patterns, and continuous development, it was possible to get rid of malaria, specifically in temperate parts of the world. But a large, proportion of the population is still suffering from these diseases. As I said, it's mainly confined to the subtropical and tropical areas of the world. And these diseases are very climate sensitive because of the mosquito component. Temperature and rainfall patterns are very, very important in terms of determining the transmission intensity of these diseases in different parts of the world. So, and with climate change, dengue and malaria are becoming more of importance or public health importance because in certain parts of the world, the transmission season is going to extend because of increases in temperature, which favors mosquitoes' lifespan and also speeds up its life cycle, and also for the parasites that these mosquitoes carry or pathogens within the mosquito, they also go through a much faster development period. So all in all, I think we're going to see quite a bit of an impact on mosquito-borne disease transmission in different parts of the world. Temperature rising in high altitude areas, that means that the disease is going to climb up. In urban areas, certain species of mosquitoes can move in because of favorable situations, heat island effects in urban areas. And mosquitoes can be also quite invasive. We have seen an example of this in mosquito species, mostly on the Indian subcontinent, moved into Horn of Africa, where it's causing outbreaks in urban areas. Malaria outbreaks, which is kind of like a new thing because, we always thought of malaria as a rural disease, but the mosquito lives in the urban areas and this, very highly adapted mosquito, and it's causing problems now in urban parts of Africa, in terms of malaria outbreaks. So it's fascinating in a way, these interactions.
I'm fascinated by the climate change thing impacting the prevalence of mosquitoes in certain areas. For those people that don't know, not to get morbid, but what do malaria and dengue diseases like this do to people, so people know?
Malaria is a disease that can be quite life-threatening in a short period of time if the person is not immune to it. And it's natural immunity with exposure over time that people get less and less sick when they're exposed to malaria. But it is a major, it's a disease that affects children under 5 years of age, those, young years, where the child would be exposed to malaria and slowly develop immunity, but it is a very, very fragile a span for a child. But once the immunity develops from malaria, then you see less sickness and less death. But so it's a major public health problem for kids and also for women who are pregnant and so immunologically suppressed during pregnancy. So those are the two key target populations. And then you can also have outbreaks in different parts where overall the population is not exposed to malaria, and then you can have all age groups basically get affected by the disease. So that's malaria, and it's part of life in many places. It's a preventable and treatable disease, and yet we lose many children and many people to it every year. So it's certainly on the top of the list. Dengue is a different type of disease that is caused by dengue viruses. There are 4 different types, and it's a hemorrhagic disease. So it means that people affected by it would bleed, internally, and it's also a disease with serious complications. For dengue, we actually don't have treatment. And the rapid diagnostic tests or different types of tests do work during certain stages of the disease. So it's mostly management of the case that makes sure that a dengue infected person would survive. And over time, with multiple infections, also you can develop severe malaria. So it gets worse with the exposure. So the two diseases are quite different in terms of their long-term, exposure to it. So, but anyways, this is I'm more of a social scientist. This is to the best that I could speak to the two diseases and their kind of clinical presentation in people. But dengue also affects young children, but I think its impact is broader on the population. As I said, over time, multiple dengue infections can actually lead to more severe dengue in the person. So again, it's a disease that is quite prevalent in more urban settings of the tropical and subtropical areas. It has a quite strong connection to the environment and climate and human mobility, as people move around, because, mosquitoes are all over. And people carry the, whatever the pathogen around with them. And, and the mosquitoes pick that up to transmit. So you can see dengue outbreaks, for instance, through the people who are traveling from dengue endemic areas to let's say, some temperate parts of the world. And then we see outbreaks, like we have seen outbreaks in Miami and, in Florida in the past, and also in certain parts of Europe. So these diseases are also quite, they go around, especially dengue, because of the vectors presence in different parts of the world.
What I'm curious about now, everyone is trying to solve climate change. Here, even at this school, people talk about it all the time, but this seems to be a more short-term solution that we need right now. So what are some ways that you're combating the mosquito challenge in your own research? I know you're working on something along those lines.
One line of defense is, of course, mosquito control. And also it makes us, it puts us in a position that we can be prepared to respond to abnormal disease events, including outbreaks. So in that regard, mosquito surveillance becomes an important component of any preparedness and response strategy. And understanding also the vectors connection with the climate, so that we can get one step ahead of the mosquito and anticipate when its proliferation, let's say, is at its peak and it's causing risk. So for that, in my work, and this is very, very transdisciplinary work, it's with the participation of quite a few who are in the public health field, from epidemiologists to entomologists to malariologists, or people who are working on dengue, and infectious disease modelers, and then people like me who are interested in more on the policy aspects of disease control. We kind of come together to understand how to develop early warning systems, and how to, one step before then, how to understand these climate and disease associations. So some of the work that we have done over the past decade in these multidisciplinary groups is to use data available in different contexts to understand, dengue climate associations, malaria climate associations, and sometimes whenever the data is there, we also kind of looked at the mosquito and climate associations to understand, some of those relationships that would give us time to kind of get ahead of the mosquito, and a couple of months or a couple of weeks, depending on the context, and inform preparedness. strategies on the ground.
How would these strategies be implemented? So those experts would handle it once they have the information how to combat that in the incoming mosquitoes?
I am sure you have heard from many other people that you hosted in your podcast is one of the hardest parts of doing public health related work. In this modeling work that we do, like any kind of work that is related to data, because we don't have all the data in the world, that there is uncertainty, in the results. So it's very important to be able to communicate this uncertainty in your findings to a decision maker who needs to act upon your findings, or whatever, let's say, the early warning system might be telling you. So that's where the close work with the decision makers and policy makers and this engagement with various types of stakeholders become important. The strong, long-lasting relationships in different contexts also become important, which kind of is a highlight of my work, that I try to develop those links through research projects to stakeholders on the ground with their participation. And it's always an opportunity for bidirectional learning, because they really guide the research questions that we work on.
I want to take a step back with regards to finding the data and preparedness of that these mosquitoes are coming in. How is what is it? I'm thinking of 5,000 computers in front of you with a bunch of data. What does it actually look like to figure out that this is going to happen, prediction and things like that?
The quality of that kind of work really depends on voluminous data, like longitudinal data, and also access to real-time data, so that you can continuously improve, the models that are running underlying this early warning systems. We started working on this with the teams that I'm involved with, kind of, going into one context and using the data and understanding these relationships, and then over time, replicating the work in different settings and getting comfortable with the methods, and also capitalizing on the advancements in the field around these modeling techniques, and then you kind of arrive at something that you are more comfortable with in terms of framework, and then using that framework in different areas. But it's really based on longitudinal, good quality data, and to give you the basis, and then to understand these interactions. And one difficult part of this is that these interactions are so context dependent. Is that you can, of course, see these general relationships between temperature and malaria or dengue. It is really, really important to kind of make those studies context specific as well, to be able to respond to to different local settings. So I'm also very much interested in and committed to developing capacity, in the methods that are used, in the settings that we work. And one common thing, again, you asked the very early on question, what kind of is common across, I think, public health, people who are working in public health, is that this commitment to capacity development, that you just, make sure that the tree keeps giving, so we are also very much committed to developing this capacity, because, as I said, these interactions are very locality specific, and it's important to have that kind of capacity on the ground to continue with the work. And this changes, at the local level, they're continuous, and it's important to take these changes into consideration and improve, the models and improve the predictions moving forward.
I remember seeing something about a long time ago how Singapore was trying to get rid of mosquitoes completely. And then I saw this thing when I was looking you up about this mosquito drone project, bringing drones in the way of mosquitoes. It seems like these things are there to target mosquitoes. It's a war against mosquitoes in a way. Can you tell me more about the mosquito drone project?
That was not a project that I worked on, but I was part of a WHO, a TDR, and an International Atomic Energy Agency. It was a technical advisory board that I was part of, and we were working towards developing a technical guidance manual for the evaluation of a specific mosquito control new technology. And during that time in Mexico, I think the footage that you have seen, the drones were releasing mosquitoes into the environment, and those mosquitoes were sterile male mosquitoes that would then go on and mate with female mosquitoes, and then the offsprings, would not be able to transmit, the virus. So it was, again, an intervention that was envisioned, and then they were trying to see in that study site whether they would, these mosquitoes would be able to replace the wild, male mosquitoes, and it's and through that way it was mosquito suppression method, in the sense that the offsprings would die faster and without transmitting, and but they would sustain the cycle without necessarily completely removing also mosquitoes from the system, which of course they have a role to play in the overall food chain. So yeah, it was interesting because when I came back home from that trip, when I explained to my 4-year-old at the time, she completely understood this feedback system and the role of mosquitoes, and how important it is that they don't necessarily harm the humans, but we also do not take them out of the ecosystem, because they're food for some other species, and it's important to keep them alive, but not necessarily that they are harmful to people. So when I described this to my daughter at the time, she completely understood the project, and it was actually a mosquito. It's, instead of mass destruction, it's more like trying to find a way to exist with the mosquitoes without necessarily having the harmful, public health issues that originate from them.
Sounds like mass creation.
Well, it's preserving them, in their capacity without necessarily being harmful. Yeah.
A lot of students might have been listening to the longitudinal data stuff, how you're gathering data with mosquitoes. Can you tell me about your lab and what's prompted you to start this lab for students that might want to work with you or might want to get into this field?
The several projects that I was involved with, provided an opportunity to be able to have our students participate in the research projects. So then I needed like a roof, for everyone to gather under as they participated. And I think that we came up with the name of the lab as we were flying to Sri Lanka for a dengue project. And it was interesting. And then, health economics learning lab came to the mind. And then I liked the acronym HELL, hell. So that was the main attraction as well. But it was really out of necessity to, kind of formalize the relationships that I have with the students and with other researchers from other academic or non-academic institutions to kind of, have a house at GPH. And it's a very, very research-heavy lab in the sense that it attracts students who would like to involve with research projects. And it has a very broad scope. Not only vector-borne diseases, but whatever research project I pick up on with teams, then, and then if there is a need, in the project, and that need can be met with a master's or doctoral student at GPH, then, the doors are wide open.
I'm curious to know some projects that students have done that excited you or impressed you in the past.
Well, with different partners, academic partners, we devolved into different projects. For instance, in Uganda, through, again, one of the trainees that I have from the NIH-funded training program, who was on the grounds in Uganda and also originally from Uganda, had this relationship with the hospital that he worked at. And the hospital was very good at their record keeping. And they had this longitudinal data on their patients, and they really wanted to improve their case management. And at the same time, some of the doctors were also trained. They were clinician researchers, but they didn't have all that much time to be able to work with the data that they were painstakingly gathering on their patients and storing at the hospital database. So they came to us with questions. For instance, colorectal cancer that they were seeing in their patients, but then they were seeing it in younger patients in Africa as opposed to other parts of the world, and they had legitimate questions. And, and some students kind of looked into that and used the data that was provided by the hospital. And, we had our weekly meetings where we refreshed or shaped the research question and did the analysis and presented at different, findings at different conferences. And the students were really at the forefront of that, as this was a project that just, sprung up because of the need and also because of, doctors on the ground really realizing that that there's something going on there that they wanted to look at more carefully with the data.
I want to close on this question because your work is fascinating, and it seems like it requires a lot of people, a lot of people. You said once that you're the maestro of the orchestra. Can you tell me what that means?
Because I kind of hopped around a little bit, into different fields. I really like listening and thinking alongside people and hearing their perspectives around a question, and then working with them to shape the research question, and also kind of record keeping, almost what I hear from people who are engaged with one aspect of the problem, and then how that comes together in a way. I find it as my own personal challenge, like around a complex problem, how the solution would look like, the multifaceted, and trying to get people around, understanding the problem better, and then, kind of formulating a research question, and then still not losing the entire team and having them contribute as we try to answer that research question. So that's where I find it most rewarding to me, the process. Sometimes regardless whether, we go in a successful direction. So most of the time we seek funding, for the research projects that we develop. But that's not really where I just really like this learning with everyone, and I'm formulating a research question altogether, and then laying the steps towards how to and I'm building a team. Usually you need more. It's like you need to make the connections where the research project would take place, and reaching out to those folks that would provide the setting, the technology. All those parts are really very exciting to me in a research project. So I don't know whether it made sense, but this is how I.
It seems like you bring people in what they're best at, and you make sure everyone's collaborating in the best way possible for themselves and the bigger picture. And that's what makes you the maestro of the orchestra.
Yeah, or that's what I aspire to be. Whether I would get to the level of a maestro, but this is where I would like to kind of, as years pass, focus my energies on, and providing a platform through this, to new generations, right? It's like the new early career researchers, and so that they can take it and take it away in a way, pick it up and take it away. So that's where the reward happens for me.
So Dr. Yesim, I want you to leave everyone with this. Well, what's next for you in your public health journey? I've been in this industry for decades. At this point, what's happening next for you? What are your next steps when you think of public health?
Well, as I said, I am very much energized by the people, and when I meet groups on the ground and talk to them, what is troubling, what is the next big challenge, hearing, and then from the people and working with the people to be able to get at those important problems. But of course, climate change is hovering all of us, and we are feeling the impacts in different ways, and from our lives, wherever we are, to and also its impact on some of the public health questions, persisting public health questions. So I think that's pretty much on my radar, to continue the work that we have accomplished, or on the heels of the work that we have done. And non-communicable diseases and mental health issues are also getting very close to my heart. They also have quite a bit of interactions with infectious diseases as well. So, and also, on the lookout always for efficiencies and synergies, and where all these diseases kind of converge in terms of service delivery. Those are, again, tough questions to get at, how to tackle a variety of public health problems under the impact of climate change. So those kind of integration questions, service integration in resource-constrained settings. So I'm kind of headed over that direction, and climate change is quite a big focus as well in my research.
Well, thanks for being on the episode, Dr. Yesim Tozan. I'm excited to see how your multifaceted approaches impact the public health world, from mosquitoes to human beings. Thank you for sharing all your insights.
You're very welcome. Thank you for having me.
Our pleasure. That was Dr. Yesim Tozan, everybody. You have any thoughts, put it in the comments down below. We link all the work that Dr. Tozan has done. And thanks for tuning into this episode. We'll see you in the next one.